All right, here we are in the lower extremity once again, and we're going to be describing now the gluteal region in terms of muscle compartments. So this is the gluteal regions. We're going to talk about actually 9 muscles. Now don't be intimidated. I know 9 muscles may sound a little bit intense, but it's not. Once you kind of get this down, you'll be fine. So let's first take a look at the first and most famous one. This is called the gluteus maximus muscle. Incredibly powerful hip extensor. So you'll find that the gluteus maximus muscle just kind of comes across here, but in the same sense, we get a second muscle with the same first name. This is called the gluteus medius. Now, notice you can still see medius even without taking off maximus. So if I take off maximus, you'll be able to see a much larger amount of the medius. Now, this is not necessarily a hip extensor as much as a hip abductor. That's why when you rollerblade, you actually use these guys better, but you could actually feel them on the sides of your body rather than grabbing onto your buns here. So that's gluteus maximus, and then here's gluteus medius. And there is a muscle that cannot be shown or is not shown here. If I were to strip away gluteus medius, you'll find a much smaller version of it directly underneath it called the gluteus minimus. So 3 gluteus muscles, maximus, medius, and minimus, and then the rest of them become these lateral rotators of the hip. You'll find here's this is what we call the piriformis muscle, a good abductor of the hip, or at least initiates abduction. And then here is the sciatic nerve. So I always remember piriformis typically, unless it's some pathological condition. Sciatic nerves typically comes out underneath the piriformis. But the other ones become the superior gemellus, obturator internus, inferior gemellus, and then quadratus femoris. Notice again, we use that term quadratus for 4-sided, and then we use the term femoris because it's found in the femur region rather than in the lumborum or in the wherever you're going to find other quadratus like pronator quadratus or other things like that. There's another muscle that tends to kind of get clombed in there. Sometimes it's called in the medial compartment of the thigh, but that's so here's obturator internus. There's obturator externus, functionally speaking, on the other side, would sometimes be called in this compartment, but we will relegate that to just R's here that we need to know. You're like, well, that's 8. Gluteus maximus, medius minimus, piriformis, superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. As you see, obturator internus comes from covering over the obturator foramen here. So pretty much by now, this is essentially just a tendon. I wish they kind of colored it so much so that kind of half of it over here would be kind of colored tendon, but that's all right. Still pretty anatomically correct. You're like, well, that's still 8. Tell me the 9th. Well, the 9th is probably one of a lot of people's favorite term because it has an interesting name. It's actually found on the anterior side, but because of innervation, it's clombed in with this gluteal region. This is the tensor fascia latae. Notice how it comes from ASIS and then goes right into the iliotibial tract, which is a thickening of the fascia latae. So when I contract it, I tense the fascia latae. So some people would say, well, when I drop a latte on my fascia, I tense it. You can say that too, or it does sound like a drink. So tensor fascia latae. So that's 9 altogether. A nice acronym that some people have used is to kind of say different things to just try to get acronyms. But one that I heard in school before, I'm not sure how appropriate it is, but the one that I remember is gimpy people shout out I quit. Ta-da! Something like that. But it goes gimpy, G, so you get gluteus maximus, medius, and minimus, people, piriformis, shout, superior gemellus, out, obturator internus, I, inferior gemellus, and Q, quit, quadratus femoris, and then ta-da! Tensor fascia latae. You'll find that, let's just review for the last ones again, and then we get all 9 of them. Again, gluteus maximus, gluteus medius, underneath gluteus medius, we can't see it, is gluteus minimus, piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris, and then tensor fascia latae, tensor fascia latae.